scapulothoracic joint mobilization. So we know that shoulder complex. So in this shoulder complex, we are having total 4 joints: scapulothoracic joint, sternoclavicular joint, acromioclavicular joint, GH joint, glenohumeral joint. So these 4 joints together we will tell shoulder complex. Now we will see scapulothoracic joint mobilization. So type of the joint is a fibrous joint, atlas surface, anterior surface of the scapula. Suppose if we take scapula, this is our anterior surface of the scapula. Here we will be having glenoid cavity, and posterior surface of the scapula, difference what we will see here, will be having spinous process of the scapula. So this spinous process of the scapula we can see posterior surface. So this posterior, this anterior. So atlas surface for this joint is anterior surface of the scapula, posterior portion of the ribs, and again posterior portion of the ribs. Here, suppose if this is our vertebral column, if this is our thoracic vertebral column, suppose this is our T1. So here, from here scapula will start. So here this is our spinous process of the scapula. This is our inferior angle of the scapula. So T1, then here T3, here it is T7. So superior angle of the scapula will be over at the T1, spinous process at the T3, and inferior angle at the T7. So posterior articular surface, posterior portion of the ribs, posterior portion of the ribs. Here we will be having no ribs posteriorly. So posterior portion of the ribs. So these are the articular surface for the scapulothoracic joint. Now arthrokinematics. Arthrokinematics means, we know arthrokinematics, the movements which are happening in between the articular surfaces. Those are arthrokinematics. So here movements: elevation, depression, protraction, retraction, medial, lateral, rotations. So to get elevation, we need superior gliding with lateral gliding, depression, inferior gliding with medial gliding, protraction movement, lateral gliding, retraction, medial gliding, medial rotations, inferior gliding with medial gliding, lateral rotation, superior gliding with lateral gliding. So all these arthrokinematics we need for this movement. So how to do these arthrokinematics, we will see practical. Now we will see just distraction of the scapulothoracic joint. So to do distraction, we have to first hold the scapula inferior angle. Here I am holding scapula inferior angle. This scapula superior angle. Just we are going to hold this. We will do just little downward movement. This is the distraction of the scapulothoracic joint. And one, now we are going to see scapular mobilization. Scapular mobilization. Here we know scapular movements like here. Scapular movements: elevation, depression, protraction, retraction, lateral rotation, medial rotation. These are the movements of the scapula. So scapula is the articulation between anterior surface of the scapula and posterior surface of the ribs. Say first rib to 7 ribs. So while doing mobilization, patient has to be in side lying position. Then we have to flex the elbow joint. Here I am taking a elbow. Patient will hold hand here. Then this is the placement: superior to the scapula, inferior to the scapula. Now we will do this glide for elevation. See, we have to hold scapula like this. We have to hold scapula. This is a medial border. I am holding like this. This is elevation. This is the elevation. See, elevation. This is elevation and depression. Like this we have to do depression. This depression. Now protraction and retraction. To do protraction and retraction, we have to hold the medial border of the scapula. Here holding shoulder. So here medial border of scapula, protraction and retraction. So protraction movement and retraction movement. Okay, protraction and retraction. So these two are for protraction and retraction. Now lateral rotation and medial rotation. Lateral rotation, patient position will be same. Here we have to hold the inferior angle of the scapula. Here we should hold the inferior angle of the scapula. Inferior angle. Okay. Inferior angle. Here I am giving inferior angle. So with that inferior angle, we have to hold the inferior angle. Then superiorly I am stabilizing the scapula. Now we are going to do lateral rotation. Like this, we have to do lateral rotation. This is the way how to do lateral rotation. Now medial rotation, positioning of the patient that we say. Here we will put. Then we will do medial rotation. This is the way how we can do